Well, in this program, we shall be discussing with a very senior medical practitioner based in Katsina, Northwest Nigeria, and also a specialist in ear and hearing care, Dr. Suleiman Abdulmajid, one of the founders of the Suleiman Hearing Care, and also a renowned ENT consultant. Now, the Suleiman Hearing Care has been changed to Suleiman Specialist Hospital here in Katsina. So the basis behind this program is for him to highlight more on why the shift from the hearing care hospital and on to a specialist hospital. I will allow the doctor to tell us more, or rather give us a brief of his background, and subsequently we dig out why this sudden change of name. Dr. Suleiman, you're welcome.
Thank you very much, the anchor.
Well, I think I would say I have not properly introduced you per se, and I would like you to do that for the benefit of the majority of the listeners and viewers.
Okay. Thank you very much again Thank you very much again on the introduction. Well, you have said a lot, but I will just also add to it that I started as a pioneer ENT surgeon in Katsina State. That's about 15 years back. And that's I was working at Federal Teaching Hospital, formerly Federal Medical Center Katsina, now the Federal Teaching Hospital Katsina. And in my practice, I established I was a co-founder of Suleiman Ear and Hearing Care Center, which we have now upgraded or encompasses or moved it to a specialist hospital. Over the years, I've had a lot of exposure in my area of interest at the Federal Teaching Hospital, and I've also contributed a lot to development of a private hospital in Katsina State in order to increase the coverage for healthcare, and especially in the area of ENT and hearing care. I've also worked in a lot of with many humanitarian groups, including NGOs, and being part of presently I'm a member of World Hearing Forum and a member of the Global Health Initiative. So now my aim is to expand the healthcare in the private hospital by involving more multi-specialties, and also leverage on the National Health Insurance scheme, and also Katsina State Insurance Health scheme for the people in which we give the people a more affordable health care, while I develop the advanced health care in other specialty. This I intend to do as our vision presently.
Well, what will be in for the people in Katsina State, particularly those who are already visiting your facility for the ENT services? What more should they be expecting? And for those who have not been coming before, what will you tell them that will attract them to start visiting this facility as a Suleiman Specialist Hospital?
Yeah, Suleiman Specialist Hospital now is going to be like any other multi-specialist hospital, but with a special value for passion in healthcare. That the center where the health facility is going to care about the people and be able to introduce a specialist care for it in terms of diagnosis and giving the best treatment. That's one. The other thing is that people that are having ENT and hearing problems, the center will still be giving them the same care as it was before. The only thing is that we are not going to be sharing the hospital with multiple specialties, and everybody will have different days of care. But for me, in ENT, as I will also give my normal service for ENT and hearing care in the center, even better than it was before.
So all the services being offered to the ENT patient will continue, and then more services will now be introduced.
Yes, all this, and we continue, and also we have more ENT surgeons that will join me in the practice, and also we are going to partner with both private sectors and multiple and more specialized doctors, specialized doctors, nurses. And we are going to have advanced laboratory services, and people will have to be able to get their results within a short interval. And we are going to have also involve more humanitarian services to people, where we are going to engage with NGOs and other corporate bodies in order to support our people, especially the people that are disadvantaged in terms of health care.
Well, Dr. Suleiman, I believe anyone in Katsina and Northwest in general is aware of how vigorously you fought towards, seeing that things are being done properly in that aspect. So, what informed this your idea of, enhancing the Suleiman Hearing Care Hospital and now to a specialist hospital? Can you share with us your thoughts before you now arrive on this decision?
Yes, actually my thoughts on that aspect stem back to more than 15 years ago when I established the specialist center, where I'm still working with a teaching hospital, Federal Teaching Hospital, Katsina, because we know that a lot of times the government takes its time to provide the best environment for the specialist doctors in Nigeria, especially doctors. That's why you have many of them going abroad. But because I have passion in staying in Nigeria, I became a co-founder for the private hospital so that I will be able to complement the government in terms of facilities and training. And anywhere the government is not actually meeting up with my demands at the teaching hospital, I can find another place where I'll be able to collaborate with people and look for support in which I'll be able to create that service. So that one goes like that, and we are able to establish a very advanced level of ENT and hearing care center. Before, in the last 15 years, people have to go out of Katsina to get service for ear and hearing. In fact, sometimes when you want to do diagnosis tests in 15 years, 10 years ago, people have to go to Abuja or go to Lagos. Until when we established them here, and now it is available even at the Federal Teaching Hospital. So people don't have to go to anywhere for ear and hearing care or ENT services, as long as everything is in Katsina. So having reached this stage, it is now time to now add multiple specialties there, which I know with our experience in healthcare, in terms of experience in building healthcare from the scratch, we'll be able to support our other colleagues that are in other specialty care in terms of inspiration, in terms of advice, in terms of looking for opportunities for them to be able to build their own niche in terms of and they will not be eager or they will have the feeling of serving their people in Nigeria than looking for better opportunities abroad.
Can you share with us some of the efforts you've made in the ENT practice?
Yeah.
The Northwest, not just Katsina in particular. Perhaps this will probably showcase really how serious you are or how committed you used to be once you set up?
Yes, when I came in as a young ENT surgeon about 15 years ago, I was able to, because before I started working, I had to go for training in India to have more exposure. And when I came in as the first ENT surgeon in Katsina State, I was able to bring a lot of the community and my boss and everyone together at the Federal Teaching Hospital to create awareness on hearing care and develop a specialist care in which we are able to do the first surgeries for the deaf in northwest Nigeria. That time collaborating with a center abroad. And with that, we are able to improve training for ourselves. I've been able to train and establish a good technical team for rehabilitation on ear and hearing care. And presently,
That's in Katsina State or in the northwestern states?
That's the first in the northwest Nigeria, and it was established in Katsina State at Federal Teaching Hospital, which we have to take care of a lot of patients from different parts of the northwest. And doing that over the years, we have been able to add value to the Federal Teaching Hospital, where the hospital have trained about an extra ENT surgeons and employed 2 other ENT surgeons that trained in other centers. So ENT has been fully established in Katsina with more numbers of ENT surgeons that are in the place. The other thing that we are able to do is to work on, because we know hearing care is a very expensive field and also neglected in Nigeria. We've been able to work on humanitarian aspect where children and adults that are deaf, we have supported them through hearing aids and free surgeries. This I do through Suleiman Hearing Educational Foundation, which was established in 2016, and I'm a director of hearing mission of the organization, and through it I've been able to support a lot of people, not only in Katsina but generally in northwest Nigeria. The other thing that we are able to do is training of the primary care health workers in different communities and villages, where we are able to bring them to be able to identify and refer to the appropriate place, especially when somebody is getting to have complication of ear disease. This we've been able to do over the years. And we thank God that in Nigeria, in our area, Katsina has been recognized as one of the states that have made a lot of impact in treatment of ear disease and hearing loss. And this has been established over the years based on our work. So now we are trying to now see how we can collaborate with other specialty so that we can improve the services, because healthcare is becoming more expensive now at every level, and I feel that coming into a multi-speciality will give me an opportunity to be able to extend our efforts to take care of the people in Katsina, because we know that Katsina State is one of the states that has the lowest economic strength, and a lot of people don't have access or cannot afford health care. So we specialists and doctors generally, we have to come together and be able to see how we be able to talk to ourselves and be able to see how our practice can support and also develop the healthcare in Katsina State to a level in which it will be accessible and to be affordable, and it also be at the best level of practice.
Well, I don't know, have you reached a kind of a satisfactory point in issues related to ENT in the Northwest? Because you've made mention of your engagement in Kano. Can you expatiate on that?
Yes, we have made not satisfied presently, but at least we have made a lot of not actually satisfied, but we have made a lot of effort, because I realized over the years that hearing care is an expensive field in terms of the basic, even hearing aids is not affordable or available. Surgeries are more expensive and the things we need are more expensive. So now We have Kano State have actually also engaged me to be able to develop and hearing care services in one of their hospitals. And also we are trying to collaborate with a private hospital in Kano in order to ensure the private individuals and corporate bodies get involved in it. So that is one of the reasons why it has not really picked up a lot, because our vision is to ensure to bring people to Katsina for hearing care, but because of the funding, it has actually not been able to move at the pace in which I would have loved. But similarly, it's also similar to Kano State, because the funding has also hindered the government from investing in it. But bringing private sector into it, I'm sure it will be able to help to build hearing care to where we want it to be in Kano State.
Well, the services you've been offering at humanitarian, part of it, will the people in Katsina still, enjoy it when you started operating as a specialist hospital?
Yes, the people in Katsina will enjoy it a lot. Even like recently, when we moved the advanced ear and hearing care, we are doing more in Kano. Out of all the people that were selected for support, majority of them are from Katsina State, apart from people that we pick from Bauchi and Kano State. Then over here, the hospital, because we are partners in the hospital, we still be able to offer those services, but instead of it to be limited to ENT, now we have more ideas, more people trying to now come into the program and also be able to help people not only in hear and hearing, but also maybe diabetic, maybe renal problems, maybe cardiac issues, maybe general consultations and many things like that. Then the hospital can also partner with other organizations in order to use the facility to help people generally. And that is one of the things that the multi-specialty hospital is going to bring on board.
Well, if you are just joining us, we are discussing with Dr. Suleiman Abdulmajid, a very senior consultant ENT, and one of the founders of the Suleiman Hearing Care in Katsina. And the facility has just been changed to the Suleiman Specialist Hospital, Katsina. If you are in Katsina, it's just opposite Duko in Bay's house. That's from Ofosori on your way to the GRA, or from the GRA on your way to Ofosori and other places. What you've been mentioning services you render, I've not heard you talking about the issue of maternal and child health as well.
Yes, because it's now a specialist hospital, we already have specialties that were major specialty, like the surgery, general surgery, and also some subspecialty in surgery that we are going to engage the specialists. The maternal and child health is also part of it, in which antenatal care will be available, ultrasound check for pregnant women, immunization for children, pediatrician will also be seeing patient. The thing is that we have a primary care services, which will now identify people that needs any other specialty care, and those specialty care we have to bring them best for them so that they will be able to take care of them. We also have a very good diagnostics laboratory services, which is manned by a clinical microbiologist, which also be able to support people in terms of diagnostics. So I think those are the things. With this being a specialist hospital, we give opportunity for all areas of healthcare, both in prevention and treatment. And it also give opportunity for collaboration with both specialists in Katsina, anywhere in Nigeria, and even abroad.
Well, we have to look at the economy and the issue of affordability. In this part of the country, visiting the private healthcare facility is mostly something being seen meant for those who are rich or richer. And your facility is at the neighborhood of the lower income earners. What do you think about the services? Will it be affordable?
Yes, it will, because the facility is located not only in the lower, it's like in the middle where we are located. You can see if you walk in little distance, you hit the GRA, and the government house is not too far from here. And if you look at the back, you enter into the middle and lower income, the main metropolis of Katsina State. So it's in a very well located area, and walking distance from any part of this part. So, but the affordability, where people health services, healthcare is more expensive now, especially looking at the economic meltdown, the change in the variability in naira, dollar, forex generally, but the introduction of the National Health Insurance Scheme, that is the effort the government is making to make sure everyone has access to insurance cover, will be able to give people opportunity for virtually almost a free healthcare services. And that is where my strength is going to be, in order to ensure that an ordinary person has access to these services. We are also looking at the opportunity where even those people that are not working in government, that are not civil servants, will be able to have a cover, and the center will be able to have that opportunity of giving the services. Other ways in which we can supplement care, especially if those people that are going to pay out of pocket, we are going to look at that, in which we are going to look at it by working with a humanitarian organization and see how they'll be able to support them to get affordable health care.
So you're telling me a patient that comes into the Personal Specialist Hospital, the Suleiman Specialist Hospital. You are about saying a patient who is a lower income earner or from the less privileged background that walked into the Suleiman Specialist Hospital could also be assisted, not just medically, but also the hospital would be able to source for funding to assist him or her if he is unable to do so.
No, not that, because the hospital is not like an NGO. The only thing that what I'm saying is that if the person has an insurance cover, like either with Katsina State Health Insurance or the NHIS, contributory pension, contributing health scheme, or the National Health Insurance Scheme, the person will have access to the care. For people that are poor, it's going to just fall in to when the people that are less privileged are being offered the care. If the hospital has a partnership with an organization that want to help in that regard, because our hospital has been known to be doing that to be partnering over the years in supporting people. So we have a credibility and we have exposure in order to use our facility to help poor people. So we'll be able to help people at interval, as I said. But by and large, even the price for people that will pay out of pocket will be very, very competitive with other facilities, and it will also be affordable.
Okay. So now, can you tell us how this facility will be located? Perhaps you have the exact.
Yeah, the facility is very easy to be located. Is very close to Kofan Sauri, because we sometimes use the Kofan Sauri gate to describe it. Sometimes we use the GRA to describe it, and also is located within the Goruba Estate in Katsina State, and opposite Alhaji Dikko Inde, late Alhaji Dikko Inde, the former Commissioner General of Customs House. Everybody knows the house is a big house, and the hospital is just opposite, adjacent to it. So, and if you are still coming to the hospital, if you tell anyone that you want to go to the hospital that take care of the ear and hearing, they will also take you there. The hospital still has an ear and hearing specialty in it. And most of people in Katsina State knows the hospital that take care of the ear and hearing care.
And for those that want to call in or send an email?
Yeah, those ones that want to call in, they can send an email to info@suleimanhairs.com, or they can also check us our website at www.suleimanhairs.com, suleimanhairs.com. And if you Google us on the internet and just Google Suleiman Hair and Hearing Care, they will take you to our website, and you will get our website and you're able to get all the information about us.
Can you tell us what benefits those who are, into the National Health Insurance Scheme or the Katsina State newly introduced contributory health scheme could enjoy at your facility? That's the Suleiman Specialist Hospital is one of those facilities to be visited.
Yeah, they are going to enjoy multi-special primary care services like outpatients. When somebody is sick, he has malaria, anything, or is not feeling well, he wants a doctor consultation, they are going to have that. They are also going to enjoy, if they require a specialist care, like if they require an ENT care, ENT operation, ENT test, hearing test, eye care, they want to be doing the antenatal services. They can also be seeing doctors here. Delivery, they can deliver their child here. The other thing they can also do is that if they require admission, we have a comfortable admission facility. They can enjoy it here, and many other things like immunization for their children, and a lot of other comfortable services, healthcare services they'll be able to enjoy. In terms of surgeries, we have facility for surgeries and admission. For especially in my own area of ENT surgeries, we have facility for NHIS insurance ENT surgeries. We know that the price which NHIS offered for payment for any surgery is very low.